Yes. Good people. Today is another day after our talks last time. I'll go on an overview of the topics that we have gone on. We have gone through. We started by some topics. We are dealing with mental health. We are dealing with mental health, and mental health is a very broad topic. Issues that are we are discussing are issues that are related to well-being of our health, mentally, psychologically, the way we socialize. So we started by having a big topic that was depressive disorders, and we saw depressive disorders are it's not just one topic that we talked about. We talked about several topics under depression, and we learned about very many things, how the brain works and how we get into depression. So let me go through some of depressive disorders that we with the type of depressive disorders before we finish the topic depressive disorder, so that today's topic, we go to today's topic and we dig deep in today's topic. We know what we will do. Previously, under depressive disorders, and we said depressive disorder is also known as depression. Yeah, it's a common mental health condition that negatively affects how a person feels, thinks, and how a person acts. It causes persistent sadness and loss of interest in activities once enjoyed, and can lead to various emotional and physical problems. We saw the physical problems that we can undergo. Yes, Karen White, Jamaican uncle, I see you are in the platform. I'm summarizing up the topic that we have covered since day one of depressive disorder. So today, the topic we will start with is sexual dysfunctions. Sexual dysfunction is a broad topic, so I'm summarizing what we went through. We talked about depression is characterized under several things, like types of depressive disorders that we talked about. Major depressive disorder, we saw that. We saw persistent depressive disorder, which we called dysthymia, and then we saw bipolar depression, yes, bipolar depression, and then we saw seasonal affective disorder. We talked about it, and then we talked about postpartum depression. You remember, for women, premenstrual dysphoric disorder. We talked about it. Substance and medication induced disorder. We talked about it, and then we talked the last topic yesterday, which was so interesting, and people were so interested about it. It was depressive disorder due to another medical condition, which we categorized into neurological diseases. We categorized into neurological diseases, infections, other infections, you remember? Yeah. So today we are going on to learn more about sexual disorders. When we talk about sexuality, what do we know about sexuality? What is sexuality? We always avoid this topic when it comes to our children, because we are adults and we don't want to discuss this topic with our children. But you see, when they come of age and they come to adolescent and they grow, it is really affecting our children, and we should really bank on it and talk to them straight, so that our children cannot have mental issues when it comes to this kind of issues. So what do we know about sexuality? Sexuality mostly is the kind of gender that someone is born with. It refers to central aspects of being human and encompasses sexual orientation, gender identity, sexual behavior, emotional intimacy, and reproduction. You see, that is what sexuality is. Sexuality, I repeat, refers to a central aspect of being human that encompasses, it involves your sexual orientation. What is your sexual orientation? Are you a man? Are you a woman? Are you you see the other gender, which is across gender, you understand about it? Yeah, yes, gender identity, sexual behavior. How do you behave? Sexuality, emotional intimacy. How do you behave towards the opposite um, gender? And also reproduction. How do we reproduce? You understand? Sexual act, yes. Key aspects in sexuality. I'm introducing a topic called sexual dysfunction. The problems that are there in sexuality that may make us get into depression, but today we will know how to learn them. And remember, we have another very nice topic that is coming after this today, which is called gender dysphoria. We want to learn why a person is born a man, but this person wants to behave like a woman. Why a person is born a woman, but the characters that this person is displaying are like a man. Yes, let's go. What are the key aspects of sexuality? Biological sex, you see, refers to physical characteristics, chromosome XX or XY, hormones, reproductive organs. You get it? So if you are XX, you know you are a female. But if you are XY, you know you are a man. You can either be born a man or a female or an intersex. You get it? But remember, an intersex should have part of a man and part of a woman. Physiologically. Physiologically. You cannot say I'm a man and physiologically you are a woman. You don't have any aspect that displays you as a, yes. So we have how many genders? We have only three genders by birth. You get it? Male, female, and intersex. Then we have gender identity. One's internal sense of being male. You see, we started by biological sex, then we went to gender identity. One's internal sense of being male, female, both, neither, or somewhere along the gender spectrum. Listen to this statement carefully. You know, when it comes to sexuality worldwide, this is a very critical topic, and some states take it very serious. So today we will be very technical and go slow and slow because we don't want to harm anyone by our talks. Yes, we will go slow by slow. If you have a question, ask. Let's be sensitive on gender issues. It affects so many people, and today we will learn how to live good with these gender issues. Now, gender identity is the second. Listen to this. One's internal sense of being male, female, both male or female, neither, you are not male or female, or somewhere along the gender spectrum, may or may not align with biological sex. You get it? You may not align. You are born a man, but you are not aligning. That will come at our next topic, which is called gender dysphoria. Yes, I introduced it yesterday. When I say gender dysphoria, at least someone is conversant with it. Examples: cisgender, transgender, non-binary, genderqueer. You see, those are part of the genders that are not male or female. Cisgender, you understand what is transgender, non-binary, genderqueer. Yes, we continue. The third one is sexual orientation. Sexual orientation refer to the genders to whom a person is emotionally, romantic, or sexually attracted to. Sexual orientation. Are you attracted to a woman? Are you attracted to a man, or are you attracted to any sex? You get it? Heterosexual, attracted to opposite gender. Homosexual, same gender. Homo means same. Bisexual, both genders. Asexual, no sexual attraction. There are some people, you get me wrong or right, they don't have any gender that they are attracted to. And when I was talking about the brain function, we understood there is a hormone called dopa. You get it after serotonin that will make you know have pleasure. So you understand so well what I'm talking about. If you don't understand, there are some videos you can, specifically the video that is for the brain function. It's very important. That's why I started by explaining the brain function so that we can understand these topics. Now, sexual behavior. Oh, there is one I don't want to forget. Pansexual. Pansexual. Attracted regardless of gender. Just imagine. You are just attracted. And you see, it's not their problem. We will see why it's not their problem. It's physiological and psychological. Sexual behavior is the fourth one. Refers to how people express their sexuality through actions and relationship. How do you express your sexuality through action and relationship? How? May not always align with the orientation or identity. This is diverse. Eroticism and pleasure. We are discussing, what are we discussing? Aspects of sexuality, biological, gender identity, sexual orientation, which we have seen heterosexual, homosexual, bisexual, asexual, and pansexual. And then we have gone to sexual behavior, and then now we are eroticism and pleasure. Involve the experience, eroticism and pleasure involve the experience and expression of desire, arousal, and intimacy, varies greatly across individuals and cultures. You see, there are some people who display their emotions differently, and there are some people who display their emotions as per their culture. They are specifically going through their culture with no turning back. They are strictly bound to their culture. Now, reproduction involves biological aspect of sexual activity that can lead to birth. And you know that is between a man and a woman. Now here we go straight to physiological and what we nature rules. A man can only sire a baby by sleeping or having sexual act with a woman. Whatever we do as doctors as IVF, that one is medical and it's like artificial. It's not. It is not nature. That one is not nature. I want to say this. When a woman goes to hospital and does IVF, IVF is intra, you take a sperm, you fuse it, and then you insert it in the woman's womb. That one is artificial. It is not natural. Nature is whereby a man sleeps with a woman, normal, and then this woman conceives and gets pregnant. That is normal production, reproduction. And then include contraceptive choice and family planning. We cannot talk about reproduction at this current generation by not talking about family planning. Yes, family planning is a broad topic. Someone or two people have told me to talk about family planning. Very soon we are talking about it. Relationships and intimacy. Emotions and physical closeness with others can be romantic, platonic, sexual, or familial. Yes, we understand what platonic is. Now, those are, whatever I've gone through is key aspects of sexuality: biological sex, gender identity, sexual orientation, sexual behaviors, racism and pleasure, reproduction, relationship. If you have a question, please don't put it on yourself. Someone told me he'll ask me a question today. Hope he'll be in the platform today. We will not have the problem of posting. Reproduction, relationship, and intimacy. Now, we have factors influencing sexuality. What are the factors that influence sexuality? Biological, hormones; physiological, emotions; self concept and experiences; social and culture. Where were you born? Do you still go as per the norms or religion? Yes. Legal and ethics, consent, age of consent, rights. In Kenya here, after you are 18, you can decide by yourself. I don't know for other countries or states, but I'm sure there are some state which is 16. In Africa, most of the countries are 18 years. Okay, sexual health law. Every country has its sexual health law, and they were written because of the state of sexuality in that state. So we should be adhere to those constitutional laws. Yes, yes. Healthy sexuality, mutual consent and respect. We should have mutual consent and respect in sexuality. We should practice safe sexuality practice so that we can avoid STIs prevention. We talked about STIs yesterday. Communication about the needs and boundaries. Aware of sexuality rights and autonomy. Yes, you understand what autonomy is. If you don't, ask. Sexual health is very important. This one is even um, is even categorized in WHO as a very important topic. That's why we have the CCC department, comprehensive care of infectious diseases that are like HIV, and we have a department that is dealing with them. Now we go on to sexual dysfunctions. Sexual dysfunctions. What are sexual dysfunctions? This is the topic of the day. What are sexual dysfunctions? Now, I will say this. Sexual dysfunctions refers to the problem that occurs in any phase of sexual response cycle, preventing the individual or couple from experiencing satisfaction from sexual activity. In mental health, sexual dysfunction can be both symptom of psychiatry, it can be symptom of psychiatry disorder and side effect of psychotropic medication. So you can take some medications and you have a problem. You get me right? Hmm? What are the common sexual dysfunction cases? Types of sexual dysfunctions. What are types of sexual dysfunctions? One, we have desire disorder. Now, these are types of sexual dysfunctions. We have desire disorder, we have arousal disorder, we have orgasmic disorder, we have, I will go through, then I'll go one by one. And then we have, what do we have again here? We have orgasmic disorder, we have pain disorder. When you're having sex and you're feeling pain, it's a disorder. When you're having sex and you know you have low libido, you see, what is low libido? You see, desire disorder, specifically low libido, also can be called hypoactive sexual desire or low sexual desire. Refer to a persistent or recurrent lack of interest in sex activity that causes significant distress or relationship problems. So what is low libido? It's this decreased in sexual thoughts, interest, or desire for sexual activity. You get it? While it is normal for sexual desire to vary, it becomes a disorder when it persists. Sometimes when it persists, it's a disorder, causes distress or interferes with intimate relationship. This is what makes families sometimes break. And you see, in types of sexual desires, under that topic, we have several types of sexual desires. One is hypoactive sexual desire disorder, HSDD, hypoactive sexual desire disorder, more common in women. You see, women suffer most with hypoactive sexual desire disorder. Persistent lack of sexual thoughts or interest for 6 months or more cause distress. When you need, you see, pleasure hormones are like serotonin and dopamine. They help you be active and happy. So when they go down, even if you are having menses periods, you feel you have a problem because the neurotransmitters in your brain are down. You see, so you are in distress. But now let's come here and see persistent lack of sexual thought or incest for more than 6 months. It means the neurotransmitters that are supposed to, they are down. You see? So types of sexual desire, we have said hypoactive, sexual desire, and then we have gone here and said sexual aversion disorder. Hmm? One is hypoactive, the other one is sexual aversion disorder. Intense fear or disgust towards sexual activity. Now, these ones are rarely diagnosed. Intense fear, but it's there. Sexual aversion. Maybe something happens and you are traumatized, and then you have sexual aversion. You fear. Right. Now, we go to causes of low libido. What are the causes of low libido? You've seen here, we've seen types of sexual desire disorder, hypoactive, sexual aversion, and we go to causes of low libido. What are the causes of low libido? We can see the causes of low libido as hormonal imbalance, hormones, neurotransmitters, neurotransmitters. These are the cause of everything in a human body. You see, hormonal imbalance, low testosterone in men and women, low testosterone in men or women, low estrogen in postmenopausal women. You see, whatever makes you be a woman, like when you're looking at a man like this, you're saying, oh yes, this man is handsome. Wherever you are attracted to a man, yes, there are some hormones that are telling you, hey, you need something. You need a person. Look at that man. Look at that beard of that man. This man is good. These hormones are down. What can we say about it? We say estrogen is low in this person. Estrogen is low in this person. As a woman, when estrogen goes down, you lack attention towards the opposite sex, estrogen. But in a man, when testosterone is low, you lack the attention towards the opposite, who is a woman. And if testosterone is high in a woman, you see this woman sometimes being attracted to women or displaying characters of men. You see, this testosterone. Yes, this is under biological factors. And then we have medical conditions like diabetes, hypothyroidism, obesity, chronic pain, cancers. This may bring down the serotonin and the dopamine and norepinephrine, and you may feel you don't need it because you are undergoing something. And you see, these are things that will make you have stress in life. Yes, let's talk about antidepressants. People that use antidepressants for so long, hmm? So mostly SSRIs, serotonin specific serotonin inhibitors. You get it? Antihypertensives. Some antihypertensives may make you may make you some antihypertensives may make you do what? Lack the interest of sex. Hmm? Yes, yes, we continue. Even the birth pills, women that use the common birth pills, the family planning pills, sometimes they may make you not be active. You get it? Fatigue or poor general health. Poverty is a bad thing because when you poverty hits, it's a cause of some infections and some cause of some problems. And then we go on and check about psychological factors, depression or anxiety, low self-esteem or body image issues, low self-esteem. I usually say every person has a physical outlook, and physical outlook does not determine your capacity to be someone who is better in the society. Every person has got his or her likes. There are some people like big people with big bodies. There are some people like people with small bodies. You see that? And there are some people who like Marcia, welcome, welcome. We are talking about gender dysfunction, sexual dysfunctions. Then we will go on to gender dysphoria. You remember yesterday what we talked about? Gender dysphoria. You get it? Now, so when we are talking about low self-esteem, about or of body image issue, you should not think about it, because everyone has got his or her uh, likes. So we really don't have to be ashamed of what we are, because you should be proud of yourself. Yes, yes, we are in body image. Let's go to past sexual trauma or abuse. Yes, like rape. That is a very bad thing to some people, and we don't really advocate for that. That's why constitutionally in every state it is wrong. It is traumatizes and it brings medical issues. Now, stress at work, you may find you are stressed at work, finances are stressing you, parenthood. Parenthood is a very good thing, but at times it starts to be so stressful, much to parents that have teenage young people. It is so stressful, and at times it reduces the sexual. Yes, I've said that, Karen White. Yes, very right. You are very right. Medications. Mostly there are some antihypertensives, Karen White. There are some antihypertensives that when you take them in bed, you don't like. You will not feel. Even in men, there are some drugs that they take, like the pressure drugs, antihypertensives, that it makes them not to have sexual function well. They have low libido. When you find out your husband has low libido and is using antihypertensives, yeah, welcome Jared Harris. Very fine. We are here discussing about sexual dysfunctions. Then we go to gender dysphoria. When you find out your husband has a problem with erectile dysfunction but is using antihypertensives, go back to your doctor. Advice is very important. He or she, if the doctor, will change the medication. This is an issue that affects families so much. Now, yes, Karen White, you are very correct about that. Please like the video, and also subscribe as we share and go on. Yes, boredom or routine in sexual activity. Hey, yes, today I'm reasoning like broadly. Boredom, just imagine boredom or routine in sexual activity. This one affects the young generation a lot. I've had some problems with teenage, 20, the Gen Zs who are getting married. One says he's just choosing one style all along the whole night. Yes, you should like cancel this young generation, but it's not even young generation, even the old generation, the millennials. You'll find a woman complaining he's using only one style, the missionary, and he's too heavy. Now, address this issue, because we don't want families to break. We want to enhance love in the family. I'm a person who is always says love is my religion. Let's make love, let's be good, let's move forward, let's be happy and resolve conflict or communication in the problem. Sometimes couples have problems, but they don't want to address them, because if you don't want to address, when this is a man and you are a woman, and a woman to a woman, we have seen transgender, yes, and you have a problem, and you are keeping that problem to yourself, you don't want to resolve it, it may end up to be a sexual dysfunction, because the feelings will be being set aside when this person thinks of a certain thing that is not resolved. Always speak out your problem to your partner. Talk. And you see, when you talk, sexual dysfunction is there because you started well. in bed you are so good, but after some years it is not resolving. Please solve issues. And then lifestyle factors. Yes, lifestyle factors. I'm talking about causes of low libido. Lifestyle factors. Alcohol or drug use. Alcohol is everywhere. Imagine we are talking about alcohol in every situation here. Alcohol, alcohol, alcohol. If you are taking alcohol, you like alcohol, discipline yourself. Discipline is very important. Discipline yourself, discipline yourself, because it makes you have low libido. High cholesterol, alcohol, more metabolism in the liver, you get fatty liver, you start having liver cirrhosis, low libido is there. You cannot. Now, when you go to men, what do you get there? The prostate swells. Why? Because low libido, the prostate is not functioning well. It starts to grow. You get benign prostate cancer. Now you cannot function because you have to take some drugs called beta blockers that they make your libido low. Let's talk to people to use alcohol responsibly. Lack of sleep. You are always working, 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 thinking about what can I make a penny tomorrow? How can I do this, this, and this? And you see, we cannot avoid working because the world right now, we live in a very funny world when if you don't work, you cannot get something. So you balance your work and sleep. Yeah, sedentary lifestyle. You always want to eat things that are fried. And as I usually say, causes of cancer, one, fried things, fried, because of free atoms. Hmm? You see, when you fry them, they come with some atoms that are called free radicals. They are free atoms. Those free radicals are the ones which make your body not to perform well, cells not to be well. They mutate for so long and then you get cancer. Free radicals. So if you are like fried foods like fries, chicken, KFC, reduce them. Yes, that is the causes of low libido. If you have a question, please ask it for yourself or your friend. Let's save marriages when it comes to sexual dysfunctions. I've talked about desires or low libido. I'll go to arousal disorders. Hey, inability to become physically aroused during sexual activity. Yes, this is not a new thing. It's always in relationships. People always get arousal disorders. Why? Let's see what is arousal disorders. Arousal disorders are type of sexual dysfunction in which a person has a persistent or recurrent inability to become sexually aroused or maintain arousal during sexual activity despite having a desire to engage in sex. These disorders can be both in male or female, because even female get aroused and are often closely related to psychological, emotion, hormonal, and physical health issues. Now, types of arousal disorder. One, female sexual interest arousal disorder in women. In women. Mm. In women, what causes is what defined by reduced or absent sexual interest includes lack of sexual thoughts. You don't think about sexual thoughts. Reduced initiation of sex. Even if your man wants it, you are not there. You don't want to involve yourself in it. A literal no genital sensation during sex. Imagine you're in that act and then you are feeling nothing. For men, for women, that is mostly a very bad thing. For men, persistent inability to get or keep an erection sufficient for sexual intercourse. It's very bad, very, very bad. But you see, what can we do? These are medical things that we can solve. Must cause significant distress and persistence for like 6 months. You don't have an arousal. When you get into the act, you arouse, you are a man, you are erect, but after some time, it's down for 6 months. That one we say you have erectile dysfunction. What can cause these issues? We can see what can cause these issues is depression. You see, depression is everywhere because centers of your brain, like the frontal cortex, whereby we get the serotonin and norepinephrine and the pleasure and neurotransmitter, which is called dopamine. It is low. Stress, work, financial relationship, finance. Yeah. Hey, nowadays I usually hear some ladies say no, no romance without finance. Finance is a very, and I usually feel for our young boys when they are dumped because they have just started working, they don't have enough, but you find some old men snatching their girlfriends. Now, as old men, let's do good, man. Let's do good. Let's not snatch girlfriends from snatch the young boys their girlfriend because you have to provide to the young ladies. It's not good. It hurts. It hurts. These are things that I talk about because they happen. Yes, these things happen. Negative body image, negative body image, body shaming. You see, there are some people who are narcissists. We talked about narcissism. Body shaming, it's not good. You have a partner, but you are when you started well, but now you are always telling the partner that nowadays you not look good. Do this to yourself so that you can do good. Please tell her, but tell him in a good way. So you tell this person in a good way so that this person can appreciate. Body shaming is not a good thing. You have a partner, you are the one who decided let's be a couple, but it reaches a point you start to body shame. You see, psychological issues. You are making this person's self interest in sex even to go down, and then you start telling people he's not good in bed. Shame on you. Now, history of sexual trauma or abuse. We have talked about history of sexual trauma several times. It is carried to the other generations when you don't like when you are approached by someone and then you bring this thing of sex. This person is traumatized, so this person will not be aroused. Performance anxiety, performance, yes, performance anxiety. You are like telling people, you are like telling your partner today I'll knick you well, and then when you get to there you cannot. So it gets to your psychology that wherever I try, I cannot manage. So you see, you will become mentally unstable, you start having depression. Now, there are some things which are normal biologically. These are whatever I'm going to say, these are the things that affect people biologically so that they cannot perform well or they can have a sexual dysfunction, they cannot erect well, or woman cannot be ready for the act. Hormonal imbalance. And we have said testosterone is a very important hormone and estrogen. Estrogen is a very important hormone to a woman because it is what defines a woman to be a woman, to have breasts, to have the figure of a woman, to talk like a woman, to be attracted to the other opposite sex as a woman. You get it? And then testosterone to a man, the opposite is the truth. And then we have menopausal or premenopausal. You know, when you get to menopause, I think this is a topic that is also, I'll take a day and talk about it. You get so many hormone fluctuations going down and up, and then you are not even interested. Maybe you are interested today, but when it comes to that time, your hormones have shifted. You get it? Your hormone have shifted. Yes, thank you, Karen White. Your hormone has shifted, and then you are not into it. Yes, let's continue. Menopause. Yes, neurological disorders like multiple sclerosis and spinal cord activity. You see, the spinal cord activity, we talked about the cranial nerves from the brain, which goes back to your down to your back like the vagus nerve. If it is injured, there is a nerve which supports you to erect or to be fine when it comes to bed. But you see, if it is injured, what will happen? You will not have feelings for it because the nerves are the ones which transport the impulses. You see that they transport the impulses. Cardiovascular diseases like heart diseases, hmm? Cardiovascular diseases. we have a lot of topics to talk about. When I read some things, I really say we really need to have a session for that, and we will have it like let's see, cardiovascular diseases. What are the types of cardiovascular diseases that you know? You see, these are things that they are in our families. And when they are in our families, we can't avoid to talk about them because they affect us. You see, we have cardiovascular diseases like coronary artery disease, cerebrovascular disease, that one affects the brain, peripheral arterial disease, we had congestive heart disease, congenital heart disease, we have rheumatic heart disease, we have DVT and pulmonary embolism, which affects women so much when they want to give birth. DVT. Major risk factors. What can make you to be? We are not talking about this. Let me just brush it. This topic will come again in future. What can make you have a heart disease? Someone asked me if heart attack is a heart disease. Heart attack is not a disease; it's a situation. Now, high blood pressure, high cholesterol, these are things that can make you prone to getting a heart disease. High blood pressure, high cholesterol, smoking, diabetes, obesity, having a very big body. So the function of your body goes down, or it makes you sick every time. Physical activity, you are not doing any physical activity, you are not active. Unhealthy diet, you know what we mean by unhealthy diet. Evelyn Minage, my friend, my sister from home, you are here. We are talking about sexual dysfunction. What can make, we are talking about sexual dysfunctions that bring depression and how we can manage them. Yes, 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 yes. We go to excessive alcohol consumption. Imagine you are married to a person who comes home late and he's drunk. After some time, you start having heart complications. Yes, we have stress. We have, even now we are talking about stress. You see that non-modifiable, those things that you cannot modify, like age, family, gender, and what? Age, family, and genetics. Now we go back to our topic. We have gone to low libido, and then we have gone to arousal disorder. If you have a topic, my friends, if you have a question, don't fear. These are things that are happening and they are affecting us. Just rise it up. Yes, we have talked about arousal disorders in men and women, and we have said they affect mostly during erectile dysfunction during sex, seen in anxiety disorder, especially in performance. And then we have seen biological, we have hormonal imbalance, menopause or premenopause, neurological disorders, cardiovascular, and then there is this one which is so common, diabetes, biological diabetes. That is a topic that is, in fact, after gender dysphoria, one day I'll have two videos that I'll talk about diabetes, and then in the evening we continue with what we are doing. Yeah, we have medication and substance, antidepressants. People that use antidepressants alone a lot, they don't have sexual desires. And specific antidepressants that are called serotonin inhibitors. Serotonin inhibitors. Why? Why can't do you have sometimes you get that you don't have sexual desires when you use this. They are called serotonin reuptake because when serotonin goes up, normally, after serotonin is released in the brain, it is absorbed by nerve cells. So when it is blocked, making more serotonin available, you know what happens? You lose the normal thinking. You lose the normal thinking. You even sexual desires go because now cognitive issues are here at the frontal cortex and the limbic system. No, we are still going on with the antidepressants, antihypertensives, alcohol, smoking, and illicit drugs. Alcohol is everywhere. Please let's take alcohol and wine at a disciplined mode. You see, relationship factors, lack of emotional intimacy. Hey, You have a partner, my friend. You are not showing even this partner that this partner is the most beautiful thing or handsome thing that has ever happened in you. Hmm? Why do you want to have a relationship and live like, even hens, at times they are romantic, but you want to make your partner look like a companion, not a partner for life. You know, there are two types of things. You have a partner who you behave like you are just helping each other to stay together. You don't talk to this partner. You all, when you want that, when you want to make love, not, I can't even call it making love. When you want to sleep with, you wait when it is very dark and then you turn around and then you tell her, I need that thing. After you finish, you sleep up to tomorrow and go. That is bad. Tell this partner of yours, you be romantic, appreciate the what God brought you. Eh? Tell this partner that you are. This is, we are talking about. We are Karen White, hey, Karen White, these things happen. You see, it is affecting us mentally. It is affecting us mentally, and it's a matter of mental issues. So we must address. When you tell your partner that, yes, my love, this is, you are the most beautiful thing that happened in my life. When I see you, I see how many days that God created you. God created you in 1005 days. Yes. You know what happens to the brain of this person? Serotonin balances. The pleasure hormone dopamine balances. It becomes normal. So what happens? The health, mental health and psychological being of this person, be it a woman or a man, what happens? He walks outside there glowing. Even if you see the face, yeah, there is no pimple. Even if you see this person walking, it is because the neurotransmitter called serotonin, norepinephrine, and the other one which is called the dopamine, they are working because of your partner is appreciating and talking to you in a nice way. And I'm not the one saying go and read DSM-5 of mental health. It will tell you the same. Relationship factors, lack of intimacy, lack of intimacy. Lack of intimacy makes people not to be okay. A person who lacks intimacy at a particular generation, mostly women, you will see them having so bad moods when they are having friends and they are talking and they are telling the friends, we are going out, we are doing this. These people become depressed. If you have one of the friends like this and is in a relationship that is not working, my friend, please help your friend to run very faster, or at least help the relationship to be repaired. Yes, we don't want to have bad generation that we are living with people who are not smiling and enjoying. Let's have diseases that come because they are diseases, not diseases that we bring for ourselves. Yes, lack of intimacy, bad mood indeed. Yes, Karen White. Conflict or poor communication. How do you communicate to your partner? You see, these are things that they make intimacy in a relationship go down. And when we talk about them and we tell people, sometimes they think it's a joke. Why do you get someone, you tell these people you love this person, and then it reaches a time that you don't want this person again? Openness and talks in a relationship. Lack of trust and unresolved issues. You don't trust your partners. Insecurities. But you see, insecurities don't just come for themselves. I usually say like that. Insecurities come because of something else, unresolved issues. So sit with your partner, resolve that issue. Resolve that issue. And let's behave like people who can resolve issues. Let's not have low libido in relationships. Let's not have low libido in relationship. With that one, we are talking about arousal disorders. And then there is orgasmic disorders. What is orgasmic disorder? I know people know sex is sex. Making love is making love. But you see, there are some people want to make love and be satisfied. Yeah? There are some people want to make love and be satisfied. So we are talking about sexual health, and these are issues that are related to sexual dysfunctions. You get it? What are these issues? Let's talk. Let's talk. What is orgasmic disorder? I know some people didn't know sexual dysfunction is a broad topic, but no, today you will know that it's a broad topic. You see, orgasmic disorder are categories of sexual dysfunctions where an individual has difficulty reaching orgasm during sexual activity despite adequate sexual desires and arousal. This condition may cause distress, frustrations, or relationship strains. You get it? May I repeat again, please? Category of sexual dysfunctions where an individual has difficulty in reaching orgasm. Climax. Orgasm is the climax where you are satisfied. You feel, yes, today I'm feeling the good thing that I've ever had in my life. That one is called an orgasm during sexual activity despite adequate sexual desire and arousal. This condition brings what? Listen, distress, frustration, or relationship strains. You start having problems in a relationships, in your relationships. Now we have several types of orgasmic disorders. We have female orgasmic disorder, male orgasmic disorder, and premature ejaculation. There are three. Because you are two making love, now we have persistent delay in frequency in female. This is in female. Persistent delay in frequency or absence of orgasms after sufficient sexual stimulation. Hmm? You romance, you do ABCD, you love, you do everything that we do in romance as we prepare for the act. But you see, after sufficient sexual stimulation, there is still delay or significant reduction in the intensity of orgasmic sensation, or in significant reduction in the intensity. You are getting to orgasm, but you can't feel it. Must cause personal distress in the at least 6 months. At least 6 months. You see, this is in female. Female. Females have problems with hormones. So when we are discussing this dysfunction, mostly they affect females because of their hormonal imbalances and menstrual regulation. That is the problem. But in men, you see, men don't have mostly hormonal dysfunction. In male, orgasmic disorders or delayed ejaculation in men may delay or absence of ejaculation during sexual activity despite adequate arousal. Now, what? Let's start in male. Male, then we go to female. No, we have a third one called premature ejaculation. A man within 1 minute or half a minute he has ejaculated. Yes, and it becomes a very bad situation to the partner. Because the partner wants more, but this other person cannot. Just imagine sleeping with your partner up to morning, and 1 minute or half a minute and he's dead. He cannot even be aroused. You will know why this happens. No. Now, what brings delayed ejaculation in men? Let's start with men. Then, and you see, these are matters that are bringing us problems mentally. What brings what brings problems in men? Why do men have delayed ejaculation? Why? Why do men have delayed ejaculation? Delayed ejaculation in sexual dysfunction in which is a state in which a man experiences significant delay or inability to achieve an orgasm and ejaculation during sexual activity despite adequate sexual stimulation and desire. Imagine, it must cause distress and relationship in relationship. This is very true. we have types of delayed ejaculation. Types: there is lifelong, there is acquired, there is generalized, and situational. So you men, if you have a partner that since you married or you started dating, he is just with delayed ejaculation present since the beginning of sexual activity, just know it is lifelong and we will know how to resolve. Acquired: it is developed in period of normal function. Generalized: acquired in all situations. This person takes alcohol, he is intimate to every woman, is and is this person is let me, I don't want to call that name pervert, but he lives a unhealthy sexual life. Situational: occurs only with certain partners or stimulation. There are some people when they get some other partners, they are not aroused with them in well, because they are not really intimate to them. The causes may be depression, anxiety. You see, these things are revolving around themselves. Religious, cultural, guilt, or sex. Now, there. In culture. You see, you may go to some religions or some let me just generalize and say religions that look like they behave like cults, and you are bound to some rules that when you get to your woman you start being guilt of delivering. You should deliver to your woman because your woman is you are with that woman. Don't be guilty about your culture or religion. No, this is the sexual act. It is us, me and you doing it. So we should be happy the way we want. Let our rules are our rules in our bedroom. Yes, and religious, you see there that there is a problem. Relationship issues. We have seen piling things up and you are not solving them. When things come up, you keep silent for yourself because maybe you fear he provides or she provides, and if you start raising issues you may be kicked out, or he'll not. You just be good, raise these issues, solve the issues, and we move on. You get it? We don't want to live in societies that we are feeling guilty every time and then we are getting mental issues because of a person. Perverts, we don't want to live with them. Trauma or abuse, we have talked about it. Low self-arousal attraction to a partner. Yes, imagine you get a partner who you know you will be attracted to this partner forever. The kind of characters that you need are in this partner. Don't get a partner because of financial issues. Don't be forced to a partner because this partner is forcing you because he knows or she knows he helped you financially. You'll be stressed the whole of your life. Yes. And then there are medical conditions. Medical conditions like diabetes mellitus. Diabetes destroys the nerves, and you see the nerves are the ones which are helping you to erect or to be ready for the act, to your heart to beat poo 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 faster. When you are looking at that man, that woman, you feel your heart is beating and racing, wanting it more and more. You see, nerves are very responsible for this. Multiple sclerosis is a disease. We will talk about it. Type of cancer that affects the nerve also, that may make you to have sexual dysfunction. Stroke. We talked about stroke, and we saw when the brain does not get enough oxygen and nutrition, you will get stroke. If the brain gets stroke, it will not innervate impulses. So you will not have the sexual desire and function normally. In men, you will have delayed ejaculation. Spinal cord injury, same as stroke. Hormonal imbalance, we have talked about it. Prostate surgery. With prostate, women, if you don't know, the prostate is what makes men erect. So it prepares a man to have sex. So if prostate health is not taken care of, if you are a man and you'll watch or you're watching this, you should be going to the hospital at an age of 28 and above to check the prostate antigen test, especially if you have a history in your family of prostate cancer. When you get to 28 and above, please be checking this PSA for long. But people say there is a myth that say when you are taking cut a lot or you don't have sexual acts, you may get it. The truth is 50-50. Please, above 28 years, go to hospital, be screening yourself. We will talk even to women. They'll be screening themselves on cervical cancer. Cervical cancer, if you want to be screened, that is a 5 minutes or 2 minute test. When we visual inspection with as iodine acetate. It's called Viavil. You just go to a hospital, you tell a nurse, I want to be screened. He'll perform that test, and then you go home happy. Very important. Medication may make you have delayed. We are talking about sexual dysfunctions, and now we are at orgasmic disorders. Pain disorders. Pain disorders may make you not to function well in bed, in during sex. And you see, when it comes to pain during intercourse, pain during intercourse, it is vice versa. Mostly, it is affecting women. And you see, when you don't have hormones that are helping you to be wet, they say wetness, you will be dry and you will be having it affects women a lot. Now, what is dyspareunia? Dyspareunia, we call it dyspareunia, pain during intercourse in women, but in men we call it vastigmus, vaginismus. Now, it's a persistent recurrent genital that occurs before, during, or after sexual intercourse and can cause distress. What can cause pain during sexual intercourse? Superficial pain at the opening of the vagina felt during penetration. You understand? Women don't have all the holes that are all size. Yes, yes, yes. So you are, or you are having a man with big something, then you pain during the entry. Deep dyspareunia, deep pain. Pain during thrush or at the cervix. When the man is thrashing, you feel pain because of the muscles that are contracting and you are not wet, there is no lubricant. Often felt in the lower abdomen or pelvis. Because when you're hitting the cervix, when this man is having a very long something, and then you are going up to the something, you will feel the pain at the lower abdomen. This is a very bad thing because at times you may start injuring your cervix and it may bring complications. Causes, these causes may be vaginal in women, vaginal yeast bacterial vaginosis. Mhm. Yes, women are prone to it mostly when they have taken antibiotics. So it may cause pain because of the infection. UTI, sexually transmitted disease. We talked about syphilis yesterday. You imagine? And then we have hormonal changes, menopause. You are when you reach menopause, some hormones does not work well. You start being dry and you need sex, and then when the penetration comes, you are dry. You see, that is not better. If there is something that can happen, like using um, progesterone pessaries as suppositories, you can use KY jelly, which is a lubricant. Don't feel, enjoy sex good and use the right thing. You buy the no, the medicated lubricant. Endometriosis, pelvic inflammatory disease, my friends, is a very bad thing. If you are prone to what are infections always, go to the hospital and be screened about the PID. PID may bring cervical cancer. It's not a good thing. That is pelvic inflammatory disease. The whole part of the pelvic is infected with the bacteria. So a woman feels a lot of pain during sex. Uterine fibroids. Fibroids are malignant and are not malignant, are benign myomas that grow in your cervix, and sometimes they bleed and cause pain. So if you have been bleeding on and off, you go and do something called an ultrasound. An ultrasound will show if you have fibroids, and fibroids can be surgically removed and you are okay. Yes, uterine fibroids or ovarian cysts. Even cysts. Cysts are accumulation of thick fluid that is inside the uterus. That may make you do what? Feel pain when having sex, because you are pushing. When it grows, it is pushing against the muscles and the nerve. Skin conditions, lichen sclerosis, eczema. Eczema can cause you to have pain because down there at the skin, there is an infection. Scars, episiotomy, child trauma. Those people that have been done cesarean section, they have some scars that when they are having sex, they feel pain. You talk to your doctor, he'll give you or she'll give you some medication that will help you during this period. Congenital anomalies in perforated hymen, separate vagina. You see, septate vagina. What is septate vagina? Have you ever gone to a hospital and then you are told you have a fistula? Fistula nowadays have become a big topic to this generation, mostly women. It is a communication between the anus and the vagina. Hmm? You need to, it's a very complicated situation, and you need to visit a doctor and do a surgical uh, uh, process that will help you close this one. A septate vagina is congenital at birth, anatomically, in which thin walls tissues of the septum. You get it. So the septum is in the vagina. So you have very thin walls that divide the vagina partially or completely into two canals. It divides the vagina from the os outside, and then to the cervix. You feel like you have two places, two down and up. So it's like you have two openings of the vagina. That is called accepted vagina. It is called miliary duct anomaly. So you that one can be. We will talk about those complications when time comes, and we continue about pain disorders. We have said about the vastigmas. What is vastigmas? If you have a question, don't be don't be shy. Just ask, or let me put my email here. You may email me if you don't want anyone to know, so that I talk about it anonymously, because sometimes people are shy about this topic. They don't want to talk about them. You see, I'll talk about it anonymously. Let me open. I see if I have other questions. I see if questions have started streaming in. Let me see if questions. Yes, there is a question. I'll tackle that question some other time. Let's continue. We finish our topic first. Now, we have talked about that one. We have talked about what is were stigmas, pain during intercourse. I'm seeing some questions have started coming in. Now, pain, stigmas is a condition involving involuntary contraction or spans of the vaginal muscles. Yes, you get it. Voluntary, involuntary. When you are having the penetration, you are having involuntary contraction. Hmm? Involuntary. So you feel pain. It's spasms. Spasms causes pain because the contractions bring pain, and you are supposed to enjoy. So you get the painful thrash, because when he's thrashing, you are having spasms. So the pain comes in. Now we have talked about male orgasmic disorder, delayed ejaculation, Female orgasmic disorder that can last in 6 months. Let's see the causes. We will go to the causes and treatment later. Now, in premature ejaculation that occurs within 1 minute of penetration after a person wishes. You see, this is premature ejaculation that occurs in male. There are some people outside here when they have a problem in their relationship, they usually shame their partners by telling them you are a 1 minute man. Premature is a common male sexual dysfunction characterized by ejaculation that occurs sooner than desired, either before or short after penetration, often within minimal stimulation, and cause distress in relationship. We have talked about that. Hmm? Occurs in 75 to 100% of sexual encounters. Imagine, that's a high rate. Present for at least 6 months, cause significant distress. You see, it's types of premature. There are types. Lifelong, we have talked, just like the other, acquired, situational, and viable. What are the causes? What are the causes? What will make a man to ejaculate early? Hypersensitivity of the penile nerves. Hypersensitivity of the penile nerves. The nerves that are at the penis, they are so sensitive. So that when you just penetrate, they are already telling the prostate, do your work, we release. You get it? Low serotonin levels in, you see, it's hormonal. Low serotonin levels in your brain. So this is a place whereby you really need to check serotonin levels in the brain of your partner, or you go to a doctor to do that test of serotonin so that we can know if you are having enough serotonin that takes care of that feeling or thought. Low serotonin level. You get it? Prostatitis or thyroid disorder. Prostatitis is a common disorder or an infection. Prostatitis means infection of the prostate, because the prostate is what takes care of ejaculation issues and stimulation issues. So if the prostate has a problem, you see it is infected. The nerves are so sensitive, and when the nerves are so sensitive, once you put your thing there and it is hot, when the nerves are sensitive, it will administer ejaculation, because it will remove the sperms from the scrotum very faster to be done with that action, so that you cannot continue stimulating the prostate because of prostatic genetic predisposition. There are some people who have genetic problems that make the nerves and the prostate to administer ejaculation faster. So we have seen hormones are here, and it's not now. It's not good to share your partner that he's a 1 minute man. This person may be undergoing a medical situation that he needs to address. So this person should go to a doctor to find out what is happening and what is making him to have premature ejaculation. Yeah, that is biological. We go to psychological. We go to psychological. We go to psychological, performance, anxiety, stress or guilt about sex, relationship conflicts, early sexual experience and reinforcement. You say performance anxiety, we are still repeating several things. Associated problems like reduced sexual satisfaction, decreased intimacy, partner dissatisfaction, emotional distress. These are things we have talked about. You treatment options of this: start stop technique. Stimulate until near ejaculation, stop. Wait, then restart. If you have a partner who has this problem, please use that technique. Start stop technique. When you start and you are about to ejaculate, you stop. You wait again, then you restart the performance, then you continue. It helps to balance the prostate and the nerves. Squeeze technique. Gentle pressure on the penis head to delay ejaculation. You see that some pressure, you may use a rubber band, like a small rubber band, to put pressure so that you don't ejaculate. You see, when you put a little pressure, the nerves slightly becomes insensitive, so you may not ejaculate faster. Pelvic floor exercise, Kegel. Even men have their own Kegel. I've seen only Kegel, some women talking about it. Masturbation before intercourse to reduce sensitivity with your partner. That one needs a discussion. Masturbation before intercourse. Now, psychological therapy is important. You need a therapist to enhance your cognitive function. Sex therapy, individual or couple based, and then focus on performance anxiety, body image, and relationship issues. Know how to solve issues within the relationship so that you may know how to live. There are some drugs that may use, like dapoxetine, yes, fluoxetine. Those ones, they help increase serotonin levels in the brain, that may help you to have a long time of having intimacy. You get it. Top anesthetics like lignocaine spray, because when you spray lignocaine down there, you will be hard a man, but you know the nerves are not sensitive, so you will have long hours of having it, and we have fun. Prognosis, that one we will not go on it. Now we are dealing with premature ejaculation, and these ones are dysfunctions sexual dysfunctions. Now causes of orgasmic disorders. Causes, will still repeat: anxiety, depression, trauma, past trauma, guilt or shame about sex. You see, biological, we will still repeat: hormonal imbalance, we will still repeat: diabetes. Those are some. And I'm seeing time has gone. Will we go through gender dysphoria? Let's see if we'll go through antidepressants. We've seen how antidepressants do, antipsychotics. You see, these are problems that affect uh, a woman and a man, hmm? And we should address them. hmm? We should address them. How can we address these issues? For women, they need sexual therapy and education, just as we have talked. What they need education. Some people don't know some very normal things, very basic issues they don't know. So they need to focus to be given a sex therapist. Sex therapist. Yes, once or twice. Hmm? You see that? It's very important. Number two, cognitive behavior therapy. Cognitive. Manage anxiety, stress, and traumas. Manage them. That's why you have a partner. Help your partner to move out of some things that happened long time ago. Hmm? It's a need when you are having a partner to help this person to move on from these stresses that are past. That's why you are partners. But you see, when you're having a partner who is not into that, that is not a partner. That one is, what can I say? Let me not say it. Pelvic floor physical therapy, we have seen like Kengen. Hormonal therapy, hormonal therapy, like vaginal estrogen or testosterone. So when you have these problems, estrogens are there. I've said we have progesterone, we have testosterone. For women that are postmenopausal women, if needed, because there are some postmenopausal women that don't need sex, so you may not need it. But for those that need, you may get the estrogen vaginal creams that you apply, and then you start feeling, yes, I'm good. I need someone. Now hormonal therapy is important, but because you have seen the centers of the brain are which brings more of sexual uh, non-desires. If you have a question on YouTube, please just post it, and as we continue, post it as we continue. Now we have behavioral techniques. We have talked about start, stop, or squeeze method. It helps in men because we have seen pre ejaculation. First ejaculation is related to is related to nerves, high sensitive nerves that excite the prostate, and this person ejaculates faster. So start stop techniques help the nerve to control themselves. You get it? And having long romance, it helps a bit. Psychotherapy or sex therapy. Sex therapy is important. You may go to a sex therapist. And then medication. There's medication like paroxetine. Yes, serotonin selective reactive reuptake inhibitors. Paroxetine helps. Topical anesthetics like lignocaine anesthetics. When you apply at the Mr. Dixon, they make the nerves not to be so they are so sensitive. It reduces the sensitivity, so you have long hours of making love. Yes, delayed ejaculation, reduce or switching method. E.g., yes, reducing or switching method. If a side effect, if a side effect of SSRIs, those drugs are there. You see, address underlying health issues. Underlying health issues here mean people that are on diabetics, or people that are hypertensive. If you are using a drug that is making you have a fast ejaculation, or not even feel, you talk to your doctor. They will change that drug to another one that will help you. Yes, we have talked about it. That is about sexual dysfunctions. Sexual dysfunctions. We have really talked for 1 hour. We had to talk today about gender dysphoria. Gender dysphoria, and I said I don't know if we forget about gender dysphoria. Gender dysphoria, I will introduce it today and we will continue it because I'm seeing I have like 15 minutes to go. I will introduce it today and then we will talk about it tomorrow in full. This is a thing that is sparking so many issues in every state, in Africa, in the USA, in Europe, everywhere. And it is bringing more discussions and topics. Gender dysphoria. Why? Why is a person born a female, but this person significantly he looks like a man and behaves like a man, but we see this person is a female? Why is a man born like a man, but now talking wants to be like a lady and is signifying characters of a lady? Gender dysphoria is psychological condition where a person experiences significant distress or discomfort because of their gender identity. You don't want to be a man. Their internal senses of being male or female or another gender, which is the transgender, is different from the sex assigned to them at birth. As you grow, you start behaving like a woman or a man, and at birth you were assigned as a woman or a man. Key concept: gender identity, sex assigned at birth. The problem, gender dysphoria is a problem which causes mental issue. And you see, the key concepts here are three: gender identity, sex assigned at birth, gender dysphoria. You get it? Gender dysphoria. A gender identity, a person deeply felt sense of being male, female, both, neither, or somewhere along the gender spectrum. Sex assigned at birth, based on physical anatomy, male or female. At birth, they saw you are male, neither or female. Gender dysphoria. What is gender dysphoria? The clinical term for the emotional and psychological distress resulting from this mismatch. Hmm? So let's continue and see. I'm just introducing this topic today, And tomorrow, we will see it in a bigger and wider way. While the exact cause is unknown, you see, it may be unknown, but it is not unknown. Medically, tomorrow, as we dig deep and open the pages inside, you will see the problem, where the problem comes. Contributing factors include genetics, prenatal hormone exposure. You get it? Prenatal hormone exposure. Hormones are always, so if you see a man is growing and speaking like a woman and behaving like a woman, think of prenatal hormones that were exposed. We'll see how hormones are exposed. Psychosocial, early childhood exposure, gender role and expectations. You get it? Neurological. Some studies suggest that brain structure difference may play a role. Brain structure difference may play a role when a person grows to turn into like a woman. And there are associated challenges like mental health condition, social challenges, self-harm or suicide, and there are others more that elevate the risk. So tomorrow is a day that we will talk about what everyone always talks about. Why do this person behave like a man? Why is he a lesbian? Why is he a homosexual? Why is he a heterosexual? Why is this person bi? You will find there are so many factors that are leading, and you see, you will find those that are honest. They don't want, but it's in their genetics, though they are pushed to be like that. But there are those that are pushed by peer pressure. We will see every factor. We will talk about these factors tomorrow and know. You see, today we have talked about sexual dysfunctions, problems that are causing any sexual. So if you are there, because my time is up, I have like 3 minutes. I have 3 minutes. I'm seeing we have questions in the email from several platforms. I'll address them privately because we don't have time right now. So if you have a question right now, I have only 3 minutes. I will address it, and everything will be okay. Everything will be okay. I'm waiting for any question as I summarize. We have talked about sexual dysfunctions in mental health, and we have talked about common types of sexual dysfunctions like low libido, desire, that is in desire. We have talked about arousal disorder. We have talked about orgasmic disorder. We have talked about pain disorder. You see, we have talked about those. Those are common type of sexual disorder. And there are some conditions that are psychiatric conditions associated with sexual dysfunctions like depression, anxiety, PTSD, trauma, post-trauma, sexual dysfunctions, schizophrenia, poor social interaction, blunted emotion, medical and side effects. Yes, we talked about bipolar is coming. That is a topic that we'll talk. Medication that may cause sexual dysfunction, we have said like fluoxetine, we have said like sertraline, we have talked about antipsychotics like Respidone and Olanzapine, they can cause mood stabilizers like lithium, they can cause benzodiazepines, yes, like anxiolytics, benzoxyl. If you are given those in hospital and then you go and you feel you are having sexual dysfunctions, please know the drugs that you are using and the ones which are causing. Mechanism behind sexual dysfunction in mental illness, we have talked about neurochemicals, serotonin, dopamine, you see, but serotonin, I usually say pleasure hormone. That is what makes you feel the need to have sex. Psychological negative self-image, that one you have talked about. Social stigma, isolation, and poor interpersonal, we have talked about. Medication. And we have talked about address the underlying issues like relationship issues, you talk about them. Sex therapy, you visit someone to help. Medications for sexual dysfunctions, yes. sildenafil, Viagra, for which I'll talk about Viagra in one of the videos in details, ibuprofen, the drugs like for pain, like brufen, when it comes, you take them, but period induced sexual dysfunction. Yes, you see that, and lifestyle changes. Thank you so much to be on the platform. I could not go deep into gender dysphoria today. We will work on it tomorrow with another topic because of time. I have to go to attend to several patients. Thank you so much on being on the platform. And I always say, if you have a question, I put my email down there. Email me. My consultation online is free. I'll advise you and we'll go to your doctor and discuss the issues that are affecting you. Be good, be blessed, stay a good day, and love every time. Love is my religion. Good day.